Have you been told you have eczema? Or maybe you notice a red, rough, itchy rash. The more you scratched, the itchier it became. Hi, I'm Dr. Jennifer Soung. I'm a board-certified dermatologist and clinical researcher. I specialize in medical dermatology, and what that means is I treat patients with serious skin diseases. Today, we're going to be learning more about eczema and how to treat it. Eczema is a general term for allergic inflammation in the skin. There are two things that are happening when you get eczema. One, a weakness in the skin that normally serves to protect our body. And then number two, a hypersensitive immune system. Let me explain both of these in more detail so you understand what's happening and how we're going to help your skin heal. The first component is that eczema patients have a skin protection problem. Doctors and scientists have discovered that eczema patients are probably missing important fats and proteins that normally serve to protect our skin and make our skin strong. So imagine a brick wall. If the cement is missing to glue those bricks together, the wall is weak. In eczema, there are probably weak bricks and bad cement, making that entire wall weak. So when that skin wall is weak, moisture also escapes easily and the skin tends to dry out. That also means that whatever comes in contact with the skin also gets inside easily and causes inflammation. This is the second component of eczema. Once that inflammation is triggered inside the skin, there's a domino effect, and there's overproduction of itch proteins that then make the skin red, rough, and terribly itchy. Let's think about a couple examples. For example, when you wear rough fabric like wool, or use harsh soaps that strip your skin of its natural oils, these things can trigger a flare-up. Other things like environmental factors, when the weather is extremely hot or dry, can also increase your chances of eczema. Usually it's a combination of multiple factors and not just one single trigger alone that makes your skin flare up. Some basic things to know about eczema. 1. There are many different types of eczema, and this makes it confusing. The most common types are atopic dermatitis, contact dermatitis, nummular dermatitis, and dyshydrotic eczema. Eczema is very common in kids and babies, but can also occur at any time as an adult. It's the itch that scratches because the itch is terrible. Number 2, it's not contagious. Doctors and scientists don't know the exact cause of eczema, but what we do know is that it has something to do with your genes and something in the environment that makes you more susceptible. And number 3, every patient's disease is different. The way your eczema looks may be different from your friend or your child's. It also appears different on different body parts at different times. In some patients, the eczema is mild and easily treated with topical medications. Other patients can have more severe forms and require steroids and strong anti-inflammatory medicines. So now that you understand a little bit more about eczema, treating your skin will focus on these two components. 1, repairing that skin barrier. And then number 2, decreasing that inflammation from inside the body. Look for my upcoming video on treatments for eczema.